Today, in Contextual Point, I am going to talk about how to differentiate lead and arsenic poisoning, which is a really high yield topic in both for step 2 and step 1. So let's get started. And we will memorize with two images. So, which one do you think uh, look like more solid and maybe more look like lead? So, the left one. And you may know that we always see arsenic in bottles in movies, so you may think like lead more like look like more solid, but arsenic not so. But in reality, they're all solid in room temperatures, but this will help us. So lead solid and arsenic is not that solid. So what I mean, and I wrote arsenic as like this, and this will help us. And as I said, lead is more solid and look like this. So lead causes constipation. Lead causes constipation. And also because of that, it causes intestinal colic. And you may see some questions that try to describe intestinal colic but not saying constipation. This is really important. So if lead causing constipation, what arsenic will cause? Watery diarrhea, because the solid one is lead. So yeah, this is really important, and you even can do questions with only this information, because generally you will try to choose the correct answer, and you will always that's in my case, I always confuse between lead or arsenic in every question, and USMLE always try to trick you with trying to confusing you between lead and arsenic. So if you know that only that information and you can catch from the question, if you see constipation, you can go on lead, and if you see water there, you can go arsenic. I'm just trying to give you practical information. And arsenic causing garlic-like odor. And this is why I always call arsenic garsenic. Please learn that in that way. Garsenic. Garsenic causing garlic-like odor. And also, as you can see, there's an S, but there's no S in lead. This is why, because this arsenic cause, garsenic cause squamous cell carcinoma of skin. And also it causes lung carcinoma and angiosarcoma of liver, which is high yield in step 1 purposes. But please know, garsenic causes SCC of skin. And also garsenic causing QT prolongation. So you may remember this like the last letter, garsenic QT prolongation. And the last thing in comparing these is lead causing lead-like limbs. Lead-like limbs, and what I mean for it cause wrist and foot drop. And you may even see in questions for just saying the patient experiencing wrist or foot drops, and you can go to the answer as lead. Another practical thing in here is what can we give for these patients? So we can give ETA to lead poisoning. And as you can see, there is 3 letters from lead word. This is how I remember always. And we can give dimercaprol to garsenic. You may see some questions in step 1. And there are some details that I want to talk. Both could lead Stocking glow neuropathies. Both could lead anemia, and you may see more anemia questions on lead. And both could lead cognitive impairment. And both can cause some type of lines that always confusing me. But if you know the information that we talked before, you will always do the questions without knowing or memorizing this. But I will advise you to look these from Google. So Bruton and lead lines occurs in lead poisoning. Bruton happens on gums, and Mies lines happening on arsenic, which is on knee bats. Nail bats. And the last thing, as just a detail, in acute promyelocytic leukemia, we use all transtretinoic acid, which is ATRA, but we also can use arsenic trioxide. And if you're unlucky, you may see a question related to that in step 1 maybe, but also if you're unlucky on step 2, you may face a question that we try to give arsenic trioxide to a patient who has APML, and it could lead QT prolongation. So this you may need to remember, maybe, if you like details, or you may just try to seize other drugs that could increase QT prolongation. This is just a detail. Okay, so I'm quite sure you can do like 95% of these questions with all of these information that I try to give you on that slide. And I highly suggest you that you should do an Anki card with the slide that we talked and try to compare lead with arsenic. And yeah, that's it. If you like, please subscribe me, and thank you.